After seeing a spike in opiate overdose calls to what one Missouri EMS official described as unsustainable levels, a special intervention program was launched in March of 2017 by the St. Charles County Ambulance District. Known as SURRT, the program is designed as a means for paramedics to directly engage with opiate overdose patients to steer them towards recovery programs as well as distribute Narcan. However, it became clear to the ambulance district that their paramedics would need more education in understanding their opiate-addicted patients.
The Substance Use Recovery Response Team is a collaboration between the ambulance district and our mental health partners to encourage patients who have overdosed to sign into our program to try to help them get treatment. The program came about after our overdoses increased over the last several years, doubled in fact, and we realized that what we were doing out here was not enough.
As part of the leadership of this organization, I get daily, weekly, monthly reports on our responses, what we're seeing, what's happening out there. And as we began to see an uptick in overdoses, specifically, we're up 50% in 2 years. You start asking yourself, what's going on here? That's not sustainable. We have to do something.
We collaborated with our mental health partners and came up with a system where we also went through our legal, and we came up with a consent that someone could sign into our program at the time of their overdose if they were awake and alert enough to do so. Our paramedics would talk to them about signing into this program where we would be able to go out and revisit them within the next 24 to 48 hours to talk to them and encourage them to get treatment.
We've jettisoned some of the preconceived notions that we've had. We've become educated. We sought out the science behind addiction, tried to understand why these patients are in the predicament that they're in so that we can help them and be that link to treatment and be that link to a better life.
I got involved because, well, unless you've ever told somebody that their family member has died, you couldn't possibly know what it feels like. And that's really what prompted all of this, because I was tired of telling people that their kids were dead. I was tired of telling kids that their parents were dead. And it just felt like we needed to do more.
The NCADA had a grant for public access Narcan, and they had doses that were going unused. It hadn't gained a lot of momentum out in the public, and there was a discussion between NCADA and the ambulance district as to whether or not we would be interested in being a distributor for the public access Narcan.
Immediately we decided we have to do more training. We have to do some actual addiction training on drugs and drug addiction with our medics. And it was amazing. The response that we got from the majority of the medics, I'm not gonna lie, I'm not gonna say all of them, but the majority of the medics that didn't have education on it completely changed their opinions. They went into it with a poor attitude and they came out with a completely different opinion and understood the disease more, agreed that addiction is a disease. That's another challenge. People don't want to admit that addiction is a disease. They don't see it like that, especially first responders. We think of diseases as diabetes and COPD and cardiac disease. We don't traditionally think of drug addiction as a disease. Again, a lack of education.
There's certainly a heavy stigma among first responders that goes along with overdoses. Because of our background, because of what we do, because we see things in black and white, we're cynical.
When I encounter people I work with who say things and make comments about addicts and people with behavioral health issues, I try to remember that it's because of a lack of education. I'm not gonna lie, I've probably had stigma in the past too, because I didn't understand it. I didn't understand addiction. I didn't understand behavioral health crises.
Being a distributor of public access Narcan wasn't on anyone's radar initially, and it wasn't something that we pictured ourselves doing, but now the opportunity presented itself. Here we're doing good things, we're saving lives, we're connecting people to treatment. This allows us to take the program one step further into harm reduction. You know, we're not condoning overdoses. We're not enabling overdoses. We're preventing deaths.